Hi, Dr. Allen here. I am going to go through the defibrillator with you along with safety in regards to the application of a defibrillator and overall environmental safety. So when you walk in, you say you come in and it's a coding patient, you're going to want to first scan the room, make sure that everybody is safe. That's going to be a common theme throughout. So you'll notice if your patient is unconscious, maybe there's a little cyanotic, their chest isn't rising, you assess a pulse, and you find that the patient doesn't have a pulse, and you would go and put on them leads to be able to identify, what's going on with them. Are they in cardiac arrest or not? And do they have a rhythm that can actually be shocked? Keep in mind, asystole can't be shocked because there isn't a rhythm to actually go and defibrillate. So you would go and remove the patient's gown and expose the chest, okay? And you'll find on the mannequin that there are actual places where you can hook up the defibrillator pads. You'll notice behind me here you have your patient monitor. So your patient monitor demonstrates for this patient ventricular fibrillation, which is a shockable rhythm. You'll bring in the crash cart for your patient, and then from there you're going to want to go and put on the pads for your patient. Somebody at this time should also be bagging the patient, all right, offering them oxygen. You would want to go and hook up, you would want to be able to go and hook up your bamboo bag up to your flow meter, okay? Just taking down the humidity. And then you'd hook this up here to fill up your bamboo bag, go all the way up to 15 liters. So you can hear it, you can hear the oxygen going through here, but you can also see that the bamboo bag is actually inflating, okay? You'd want to go and position the mask in a CE fashion, out the pillow so you can open up the patient's airway. However, new ACLS guidelines prefer that you have 2 people to administer oxygen. But say if you were on your own, you'd have to do something to help the patient. You'd want to be able to go and cover their nose, cover their mouth, literally having it in a CE fashion. A lot of you have done CPR classes, so you understand a gentle squeeze of the bamboo bag. And of course, during all this, you would be doing CPR. Now, as far as safety goes, when you're actually defibrillating the patient, you do not want the oxygen on the patient. You want the oxygen as far away as you can from the patient, all right? So environmental safety, when it comes to using a defibrillator, oxygen should be away from the patient. You should make sure as well that there is no water or anything like that, and that also nobody is touching the bed or touching the patient, because then that person who's touching the patient, touching the bed, can potentially experience the electrical shock that the patient does and will be jolted across the room, and that's just kind of unpleasant. So make sure that everybody's clear. So you would say, I'm clear, you're clear, we're all clear. Don't just say it, look around, scan the bed, scan all around. If you find that maybe somebody's not clear, you're saying, I'm clear, you're clear, all clear, and your colleague is still touching the bed, you need to tell them, we're defibrillating, you need to not touch the patient, not touch the bed. And again, also you'd want to say oxygen is away from the patient as well, ensuring that they do not have any oxygen that's attached to them. So for now, I'm going to show you how to operate our defibrillator. So again, step 1 is environmental safety. Scanning, making sure no one's touching the patient, and that also nobody is touching the bed, oxygen is away, and all of that. However, that's actually when the shock is delivered. But during all of this, there should be CPR that should be going on. Okay, so again, you're acting as the heart, so the pumping needs to be done a really good job. So about 100 compressions per minute. So you'll come to your cart. Someone should have brought the cart in, and you'll notice that you have a defibrillator on here. Now the mannequin is actually going to get live energy being delivered. Call it joules, okay? Live joules that are actually going to be defibrillated. Now you're going to notice that these actually are labeled where you need to put them. So one says sternum, one says apex. Think about A and P, where they belong. Okay, and if you don't remember, maybe it's crazy in the moment, it shows nice pictures. On this mannequin, it almost looks like little buttons where you would want to go and stick it. So you'll literally hear, you'll hear a little snap. When that snaps on, that's how you'll know. And you can even pull, they're not flimsy, you can even see they're not flimsy. You'll actually be able to go and identify that your patient, the mannequin has them on there. So from here, you're going to actually be able to turn it on. Okay. You'll hear the beep. You're going to notice that on here, with your defibrillator, the waveform is here and it's matching that's up there. Okay. If you're not getting a waveform, say maybe one of them's off,
check pads.
It's going to tell you to check the pads, okay? So that way it'll again be a little extra safety measure. So then you're going to want to put it back on, and then it's going to pick back up again, okay? So let's see here. So it says check pads, poor pad contact. So let's see. Okay. Perfect. Okay. So you can see right here that you can see your rhythm. If you wanted to change waveforms, okay, you can do that by selecting the wave button. Okay. And it'll change that. You can see the patient's in a ventricular fibrillation. Now when the time comes that you're actually going to defibrillate the patient, because keep in mind you're not going to continuously defibrillate this patient. There's going to be several minutes that are going to go between, and medication required as well for the patient to get defibrillated again. But when the time does happen, you're going to go and select defibrillator as your option. Okay. This is a biphasic defibrillator. Some defibrillators are monophasic, some are biphasic. So this is biphasic. So you're going to want to start defibrillation at 200 joules. So how do you do that? You're going to go to energy select, and there's an up and down button. So up would mean you're going to go up, the little arrow pointing up to 200 joules. If you wanted to go down, say 150 joules, you could do that. You'll find that you can go on this biphasic, it'll tell you how much you can go up to is 200 joules. Say if you were using a monophasic defibrillator, you might go up to 360 joules. Okay? But let's say we'll do it at 200 joules. What you're going to do is then from there, so it even tells you on here 1, 2, and 3. All right? 1 meaning this is step 1 to do, then the following step 2, and then the third one. Okay? So you're going to charge it. You're going to hear a beeping sound. Okay? And it'll tell us then when it's ready to go. Hear that obnoxious sound? You tell everybody, I'm clear, you're clear, we're all clear, oxygen is away from the patient. Stand, the person who's going to hit the button needs to stand. And then as you hit the shock button, look at your patient, look around, make sure everything's good. Okay, I'm going to shock now. 1, 2, I'm shocking on 3. 1, 2, 3. Okay. Looking, shock's been delivered. Report that so that way the person who is actually going and doing the documentation can write that down and analyze what time that was too, because you need that. So you can then see for the patient, okay, they're continuing to be in ventricular fibrillation. After the shock's been delivered and everything's been cleared, you can then go back onto the chest and continue with CPR and administration of medications or whatever it is that the provider is asking that you do. Other than that, that pretty much concludes the use of the defibrillator and ensuring environmental safety. All right, let's see.